Yeah, thank you for inviting me along. I'm Helen. I run Peaches Patient Voices. I'm just going to tell you a little bit about it, what our current members have to say about being a part of it, and how and where to find out more information. So basically, Peaches Patient Voices is a group of people who have lived experience of womb cancer, either as a patient or a carer. And basically, it's anybody who's willing and interested in getting involved with and shaping womb cancer research. You don't need any special skills. You just need to be interested in sharing your views and perspectives and your experience of womb cancer. And you need to be keen to work with researchers. And basically, it's all about ensuring that the work that they do, the research they do, is relevant to people with womb cancer. So I think for many of us, my background, I had womb cancer a few years ago, but it's about using your own experience to shape the future of others who are going to go through this cancer. So what's involved? So I will hear from researchers. We've told lots of researchers that this is going on, that we're available. And when a researcher contacts us, we will email out the details of what they're looking for. And you are welcome to get involved or not get involved as you wish. There's no obligation whatsoever. And the research that you can get involved in is very variable. It might be just a one-off review of some study or patient information. It might be a request to take part in an interview or discussion group or a workshop. And in some cases, it's been more building long-term partnerships with researchers throughout a whole course of a study. So, I mean, a couple of examples we've had one study which is looking at increasing or helping women with womb cancer to increase their physical activity after treatment. We've got a group of members involved in that one. Another one, we've got another group of people, another group of members who are involved in the study, which is looking at shared decision making around womb cancer treatment. So there's something for everybody, really. And so you're welcome to pick and choose what you fancy, really. I mean, sometimes we're oversubscribed, which is a lovely problem to have. So sometimes I have to draw names out of a hat, but yeah, that all depends. Apart from opportunities to get involved in research, there are other opportunities to use your voice as well. A lot of our members have written blogs, and if you go to Peach's website, you can find those. There's a couple of lovely examples, actually, of people who've been involved in actually the two long-term activities I've just mentioned, the study looking at increasing physical activity and the one about shared decision-making. So do go and have a look at those at some stage. Some of our members have taken part in some public speaking opportunities. So just this week, actually, Wellbeing of Women have run a webinar about symptoms of gynae cancers, and a couple of our members have spoken about that. And I think we'll be circulating details of that if you're interested. We have some members who've joined an international patient expert group in association with a pharmaceutical company. And also some of our members have made some incredibly valuable contributions to some NICE and SMC submissions. So NICE is the National Institute for Care and Health Excellence, I think, and SMC is the Scottish Medicines Consortium. So these are both national bodies which are looking at the cost effectiveness of new medicines. And what they really need to hear is a patient perspective, the patient experience of what these new drugs would mean. So there's a couple of those been going on this year, and if anybody in this webinar is listening who's contributed to those, thank you, because we really couldn't do that without you. But that's enough for me. It's patient voices, and that's plural, and it's really important we hear from lots of people. I say my experience of womb cancer is very different to the next person's. So what I've got on the next slide are just a few quotes, which I think illustrate, I think, quite nicely how our members feel about being part of Peach's Patient Voices and what they've got out of it. So let me just share those with you. I'll just read them out in case you're not online and not actually watching the presentation. So it is so important to use my experience to contribute to any work that is being carried out in womb cancer. I do believe that you can take something horrible and use it for good. It felt empowering to be able to share my point of view and experience like it was helping something good to come out of what has been a trying time. Being a being a patient voice participant is an important opportunity. I'm excited to think that my experience can hopefully feed into the health and well-being of future cancer patients. I was amongst a lovely group of ladies, all of whom had amazingly strong voices and who felt safe, comfortable, and confident to share their experiences. It was so good to be able to talk to other people who have gone through the same thing. What interested me about the project is that the clinicians are finally listening to what patients want addressing. So I think you can see there a range of thoughts from some of our members, and I don't think I need to say much more other than it's just such a valuable resource. We've had lots of feedback from researchers about the benefits of involving this group of people who've been through something very unpleasant. But this is something good that can come out of it. You know, we are all stronger together, and if you would like to join or to find out more about it, you can contact us. There's an email there which will come straight through to me. You can go on our website and have a look at some more details about it there. But just if you're not interested, that's absolutely fine. Keep an eye on our social media, because if we do get opportunities for people to take part in research, we will often try and circulate those as well. So yeah, keep an eye on our social media.